Hey guys, follow up to one of my other videos. Basically my blue trauma bag, I showed what was inside the airway compartment, which you see on the side here. Went through that in one of the videos, so this is basically a follow-up video to my paramedic on-car trauma bag. So I basically got split up into two sides. This side here that you see is basically meds and IV supplies. I keep the blood pressure cuff there as well. That just kind of slides in the middle. It's the only real practical spot for it. Here is the glucometer. Checking diabetic's sugar level. I keep the tube of instant glucose in there as well, just so it's handy. So right here I got the medications that we use in our area. Basically our protocols, there's a glucagon and shot in there, there's Narcan, PO Benadryl, and a vial of Epi, or a nebula of Epi, and that's about it. Nitro, aspirin, a thermometer, tympanic type. This is everything for IV start. It's inside here, all the catheters. In here is all the syringes, different types of syringes, blunt tips, needle tips, saline preloads, IV administration set with a lock. There's normal saline, 250cc bag, D10W, sugar water basically, 250cc bag. I keep the 250cc bags because they're nice and light. Here's one of the cuffs, BP. And then there's another one in there somewhere. There it is, child. Few diagnostics, scissors, pen light, jiffy marker, tweezers, pen, small scissors. In the bottom here there's a razor, if I can get it out. There's a razor right there, a little bit of tape and a tourniquet, some band-aids, and a preload, 10cc preload. Over on this side, this is basically the trauma side, although I do keep the sharps container here. Red bag for catching puke, some assorted tips. There's a worst case scenario Esmark bandage I keep for hand amputations, leg amputations for applying pressure. Tensor bandage, sterile rolls of gauze that I can also pack wounds with. This is a little minor wound bag. There's a razor and some Dermabond, assorted band-aids, Telfa, steri strips. Basically, there's trauma dressings, assorted gauze, Telfa, 4x4 steriles. In the bottom, keep a bag of bulk gauze, some stretchy stuff for holding head dressings, and a few nebules of saline for irrigation purposes. This is more of the bigger stuff, ABD pads, burn dress, just a sterile non-stick 12x12. And there are some triangular bandages in here as well for arm slings. I don't keep a SAM splint in here because usually we know when we're going into fracture calls, so I just bring it with me. And I keep a set of soft restraints on the side as well. And I think I showed this in the other video, low pulse oximeter. That's pretty much it. That's the kit that I use on car on ambulance. Let me know what you guys think.